Hello students, we'll discuss about this instrument, very common instrument. Just check what these two instruments are. Look at this. One is here, finger bows are there, proximal jaws instruments, and here you can see that opposing teeth like this. Another is different entity, same finger jaw, but there is a curvature like this. There is an opening called fenestra down here, and this is connected like this with the serrations over the tip of the blade, smooth serrations, where here is the teeth. So what these two instruments are, first one is Alice tissue holding forceps, because it opposing teeth, a traumatic, remember, very commonly used instrument. Without Alice, artery forceps and these essential forceps, we can't do any even small surgeries. These are the essential instruments actually. And this is Babcock's forceps. Now this is mainly used in racing, holding the flaps, rough structures, aponeurosis. It's traumatic, remember. So it should not be used to hold bowel, nerves, vessels, soft tissues, where delicate structure, because it will cause trauma. Whereas Babcock's forceps is, it has got a curvature over the tip, and with this triangular opening called fenestra. And in the tip, this opposing, there are no teeth, but serrations are there like this, serrations. So serrations are atraumatic, soft there. So it is used to hold bowel, entire bowel, stomach, duodenum, small bowel, appendix, large bowel, fallopian tube. What's the difference? All tubular structures are held with Babcock's forceps because it is atraumatic. Remember, all these bowel, all bowel appendix should not be held using Alice forceps. So delicate structures should be held with the Babcock's forceps. The point you they are atraumatic. Alice, Babcock, very commonly used instrument. You should know the difference. Should be able to identify in your oxy and instrument exam. And YU also they ask, MCQ also they will ask. So answer the MCQ. What this instrument is? Look at that. A. Lane's tissue forceps. B. Cocker's forceps. C. Pedicle clamp. D. Morant-Baker's forceps. So put your answer in the comment box, students. We'll have a discussion there, and go through my clinical method in surgery with the video lectures, operate my manual of surgery, details about surgery in detail for UGs and PGs, and operate surgery in 2 volumes for the technique of the surgery, and my DigiNow lectures through JP for everything covers for UGs, all syllabus, including specialties, operative surgery instrument, specimens and images. So please go through that, subscribe or purchase the thing for 1 year, so that you will have the full idea about the surgery basics for undergraduates and PGs also. So students, I hope you understood this instrument, very common instrument, Alice and Babcock forceps very well. Thank you very much.